1. What is a primary role of a doula during the prenatal period? A. Diagnose medical conditions. B. Provide emotional and informational support. C. Perform ultrasounds. D. Administer medications. Two. Which of the following is a key benefit of prenatal doula support? A. Increased likelihood of cesarean delivery. B. Shorter labor times. C. Improved relationship with the partner. D. Reduced need for epidurals. Three. During a prenatal meeting, a client expresses fear about childbirth. How should the doula respond? A. Reassure them that labor is easy. B. Dismiss their concerns. C. Listen and provide evidence-based information. D. Suggest they avoid thinking about it. 4. A doula is reviewing a birth plan with a client. What is the doula's role? A. Approve or disapprove the plan. B. Suggest only hospital-based interventions. C. Advocate for the client's choices during labor. D. Direct the medical team to follow the plan. Five. Which technique is most appropriate for a doula to teach for relaxation during labor? A. Guided imagery. B. Deep abdominal breathing. C. Progressive muscle relaxation. D. All of the above. Six. What is one of the primary roles of a doula during active labor? A. Deliver the baby. B. Make medical decisions. C. Provide continuous emotional and physical support. D. Monitor fetal heart rates. Seven. Which position is often recommended by doulas to facilitate the progression of labor? A. Supine. B. Lithotomy. C. Hands and knees. D. Trendelenburg. Eight. How can a doula support a client experiencing back labor? A. Apply counterpressure to the sacrum. B. Suggest lying flat on their back. C. Administer pain medication. D. Perform a cesarean section. Nine. What is a hydrotherapy technique often suggested by doulas during labor? A. Using warm compresses. B. Encouraging walking. C. Immersion in a birthing pool. D. Applying cold packs. 10. Which of the following is an example of nonverbal support provided by a doula during labor? A. Coaching in breathing techniques. B. Holding the client's hand. C. Offering medical advice. D. Explaining the stages of labor. A doula's role in postpartum care includes: A. Diagnosing postpartum depression. B. Supporting the family emotionally. C. Prescribing medications for recovery. D. Making feeding decisions for the baby. Which feeding method should a doula support during the postpartum period? A. Only breastfeeding. B. Only formula feeding. C. The method chosen by the family. D. No feeding discussions. A postpartum doula may assist with: A. Preparing nutritious meals. B. Administering vaccines. C. Providing physical therapy. D. Diagnosing mastitis. What is one common concern postpartum doulas address for new parents? A. Infant sleep patterns. B. Financial planning. C. Career changes. D. Buying baby clothes. What is an effective way for a doula to support a client experiencing baby blues? A. Dismiss their feelings as temporary. B. Refer them to a psychiatrist immediately. C. Offer a listening ear and validate their emotions. D. Encourage them to avoid talking about it. What is a key aspect of maintaining professionalism as a doula? A. Avoiding all contact with clients outside of appointments. B. Respecting client confidentiality. C. Making decisions for the client during labor. D. Offering medical advice when needed. If a client asks a doula for medical advice, the doula should: A. Provide an opinion based on personal experience. B. Refer them to their healthcare provider. C. Avoid addressing the question. D. Research online for a quick answer. How should a doula handle a conflict with a healthcare provider during labor? A. Argue with the provider. B. Support the client calmly and professionally. C. Leave the room. D. Take over decision-making from the provider. 19. A doula's support should be based on A. Their personal beliefs. B. Evidence-based practices. C. Hospital policy only. D. The healthcare provider's preferences. If a doula cannot provide support for a scheduled birth, what is the best course of action? A. Notify the client at the last minute. B. Cancel without a replacement. C. Arrange for a backup doula. D. Suggest the client go without a doula. Which hormone is known to increase with doula support, aiding in labor progress? A. Oxytocin. B. Cortisol. C. Adrenaline. D. Progesterone. Doula. A doula is a trained professional who provides continuous physical, emotional, and informational support to individuals during the prenatal, labor, childbirth, and postpartum periods. Doulas are not medical professionals but act as advocates, companions, and educators, focusing on improving the overall birth experience for clients and their families. Here are 5 top beneficial uses of doula. 1. Improved birth outcomes. Studies show that continuous support from a doula reduces the likelihood of interventions such as cesarean sections, epidurals, and assisted deliveries. Doula-supported births often result in shorter labor durations and fewer complications. 2. Emotional and psychological support. A doula provides reassurance, encouragement, and a calming presence, which can reduce stress and anxiety for the birthing person and their partner. This emotional support fosters confidence and a positive birth experience. 3. Physical comfort during labor. Doulas offer hands-on techniques to manage pain and discomfort, such as massage, counter-pressure, position changes, and guidance with breathing and relaxation exercises. 4. Personalized advocacy and education. Doulas help clients understand their options, make informed decisions, and advocate for their preferences during labor and postpartum care, ensuring that their voice is heard in the birthing environment. 5. Postpartum recovery support. In the postpartum period, doulas assist with breastfeeding, infant care, and emotional adjustment. Their guidance can ease the transition to parenthood and reduce the risk of postpartum depression.